Hi everyone, my name is Lynn Taggart. I'm a realtor here in Central Oklahoma with Coldwell Banker Select. And I typically make videos all about what living in Oklahoma is like, primarily for those folks thinking about moving here from out of state. It's happening more and more, by the way. Hopefully providing a little insider knowledge about the good and bad points of this place so that they know what they're getting into before making the move. I've lived here all my life, so I can be an information resource for you in that regard if you're interested. My website and contact information are shown down below. But hey, you didn't click on this video to hear about that. No, the topic today is completely different. It's all about helping you benefit from the recent experience my wife and I had trying to find a place for her 88-year-old mother to live, since continuing to live alone at home was no longer an option. Now, fortunately, the good news is we eventually found her a wonderful place, but not without a lot of ups and downs along the way. And I'm hoping that by us sharing our experience, we can help you avoid many of the pitfalls we encountered, making your search experience as painless as possible and helping you find a great place for your loved one. And as an added bonus, I'll fill you in on some nuggets of information we picked up along the way about the senior care industry that you might find helpful. Now, most important of all, I'll let you in on a little secret, something we stumbled onto that made a world of difference in our quest. Well, what was it, you ask? Well, you may be surprised to learn that there are terrific local senior care experts in your hometown ready to assist you in your search process. You just have to know where to find them. And the best part? Their services are typically free. So stick around. In the next few minutes, I'll share with you our in-depth experience with the service we used here in Oklahoma City, recapping the invaluable assistance they provided, and also fill you in on how you can locate similar resources in your town. So I'm guessing you're looking for a place because for assorted reasons, your loved one can no longer live at home safely in their own house or apartment. I get it because, as I said, we face the same challenge. My mother-in-law, a widow, fell several times last December in her home, and unfortunately the last one left her with 2 fractured vertebrae in her lower back, resulting in admission to the hospital to heal and rehabilitate. Ouch. Now, while she was in the hospital, knowing that she could no longer live at home, we began the frantic search for a care facility for her, looking for a place that was clean, offered good care and safety, was affordable, more on that in a little bit, had availability, and hopefully, if we were lucky, was conveniently located close to us. We soon learned that finding such a place was easier said than done. Now, in our case, after running around like a chicken with our head cut off for a few days looking for such a place, we stumbled upon the expert resource I just mentioned that made the process a breeze and gave us peace of mind that the choice we made was a good one. I decided to make this video since I don't want you wasting your valuable time like we did in our search. And in our case, the time saver we discovered was a local organization, Senior Care Referral Services of Oklahoma, whose entire mission, we subsequently learned, is to help families find a great senior care facility for their loved one. And most important of all, their services were typically free to the loved one's family. I made this video because unfortunately it turns out a lot of people out there are unaware that help like this is even out there. Now, if you're outside of Oklahoma, I know what you're thinking. Well, that's fine, Lynn, but how's that going to help me? I don't live in Oklahoma. Well, if that's you, don't worry, because if you stick around to the end, I'll share with you how to find a senior advisory service in your area, similar to the one that we used. So today's video will be about 3 things. 1, the numerous challenges and frustrations we encountered trying to go it alone. 2, the long list of things the Senior Advisory Service of Oklahoma was able to do for us to make the process go much more smoothly. And 3, discuss the 5 things we picked up along the way in general about the senior care industry and selection process. Information that you might just find useful during your search. Now, all this is coming from the perspective of someone that at the outset knew nothing about this industry. But one thing I learned all too well during the process is that we, as adult children of aging parents, we often find ourselves responsible for arranging for their care. And let's face it, that responsibility can really turn out to be a heavy burden to bear, because the last thing you want is for your loved one to suffer because of a poor choice you made in picking a place for them. I think we'd all agree on that. So this video is all about helping you avoid just that kind of regret. With my mother-in-law's rehabilitation period nearing an end, we were informed by the hospital that she would be discharged in 7 days. And according to hospital protocol in these situations, they needed to know where she would be sent upon discharge. We didn't have an answer. And so we were now on the clock to find someplace that would take her. What did we do? As is typical, we started frantically calling around to local facilities while simultaneously trying to do research on the internet about the types of senior care facilities that would be appropriate for her needs, including checking out national sites like A Place for Mom, caring.com, and senioradvisor.com. And by the way, I soon learned to be very careful with these, more on that in a bit. But that entire exercise only opened up a can of worms of even more questions than we had before. Remember the saying, you don't know what you don't know? Well, now I was learning how much I didn't know. And guess what? It was a lot. We were entering a brave new world, and suddenly we had a million questions. Things like, what's the difference between independent living, assisted living, memory care, respite care, and long-term skilled nursing care, i.e. a nursing home? What was an ADL assessment? ADL, I soon learned, is short for activity of daily living. And why did that matter? What part did Medicare play in paying for all of this? What part did her Medicare supplement policy play? What's this program called Medicaid? Which local facilities currently have good reputations or bad for quality of care? Was there an independent source of ratings information for these facilities? It's up to date. What was the monthly cost of the facility? Was there an initial deposit required? What's this thing called a community buy-in? What were their minimum requirements for admission? And more importantly, was there even room availability currently at the facility? If not, was there a waiting list? Where were the various facilities located? Halfway across town or right down the street? Did my mother-in-law have enough monthly income to even afford any of these places? Would we have to sell her house to raise funds for her care, like I mentioned earlier? You get the picture. There's a lot of information coming at you all at once. Sometimes a picture speaks 1,000 words, right? Now, to put it bluntly, we were beginning to suffer from paralysis by analysis, unsure as to what the right choice was, and fearing that we might end up regretting our choice later on once she'd moved in. And with each passing day, we were constantly being reminded by the hospital staff that the clock was ticking down to her discharge date. And then, as we were drowning in all this information, a miracle occurred. Hallelujah. Now, one of the administrators in the hospital's rehabilitation wing, knowing in her current condition, my mother-in-law could not return home and that we were under the gun timing-wise to find a place, suggested we call this organization called the Senior Referral Services of Oklahoma. She mentioned that they've, quote-unquote, helped a lot of former patients and their families. Founded in 2014, their contact information is shown below in the description box if you're in the central Oklahoma area and interested. We were reluctant to call at first, thinking that they'd charge an arm and a leg for their consulting services. We didn't really have a budget for that. But looking at their website, however, we were relieved to learn that their services are free to their clients and that they made their money by being paid a referral fee by the local facility the loved one was placed in. Admittedly, I zeroed in on the free part, but the abundance of 5-star Google reviews from previous clients didn't hurt either. So, given that our backs were against the wall, I picked up the phone and made the call, and boy, I'm glad I did. We had to leave a message on a recorded line explaining our situation, but in less than 30 minutes, we received a return call from Lisa Ritchie, one of their reps, who introduced herself and then listened carefully as we explained our situation, asking several questions about my mother-in-law's condition and capabilities during our lengthy initial phone conversation. And when we hung up from that call, it was immediately apparent how little we knew about senior care. To be frank, it was a no-brainer making the decision to use their service. And having someone like Lisa on your side, it was really like having your own personal industry insider to advise and help you avoid making a big mistake you would regret later. During subsequent conversations in the days ahead, Lisa schooled us on the types of facilities we should be considering, giving her insight on the ones in our area that had good reputations for quality care they offer, and the ones that were challenged in that area, the ones that actually had availability at the moment, very important given we were on the clock to make a selection, the costs involved, which were substantial, and the location of the one she recommended, important given where my wife and I live and work. Not only that, but in the days ahead, Lisa went above and beyond even further, touring multiple facilities with us to give her opinion of each, actually being there with us and our loved one in the hospital room when the senior care facility staffers came to the hospital and did their in-person care level assessment of my mother-in-law's condition and capabilities. She leveraged her local contacts to find us a facility with availability when we thought none existed, and she answered our calls and text messages at all hours of the day and night. As you can see, Lisa was there beside us every step of the way, providing invaluable advice and assistance, and frankly, I'm not sure how we would have managed without her help. Just remarkable service provided by a truly remarkable professional. And if Lisa, if you're watching this, thank you. All at no charge to my family. Now, disclaimer, your experience with them may vary, but we were very pleased to say the least. However, as always, do your own due diligence. Bottom line is that we were fortunate to learn that, you know what, you don't have to go through this process alone. There are people out there who are eager to help, so use them. And that leads me to the third part of this video, our indoctrination into the senior care industry. One of the benefits of this entire experience is that along the way, my wife and I both got a crash course on the many ins and outs of this industry. Here's the 5 things we learned along the way that I thought might be worthwhile to pass along to everyone, to at least get you up to speed for whatever might lie ahead if you ever find yourself in this same situation. Number 1, facility types. So we learned that there are 5 types of senior care facilities: 1, independent living; 2, assisted living; 3, skilled nursing care; 4, memory care; and 5, respite care. Now, independent living is ideal for seniors who are active and self-sufficient but prefer a community setting where they can enjoy community activities. Assisted living provides support for seniors who need help with daily tasks like dressing, bathing, medication management, toileting, and meal preparation. Remember those activities of daily living I already mentioned? That's what I'm referring to here. But these folks do not require full-time medical care. Skilled nursing facilities, also sometimes known as nursing homes, provide 24/7 medical care and supervision for seniors with serious health conditions or those recovering from surgery, illness, or injury. Skilled nursing length of stay can be either short-term — Medicare will help with the cost for a short-term stay, by the way — or long-term. Medicare will not, definitely will not help with the cost here. That's on you. Memory care is a specialized form of senior living designed for individuals with Alzheimer's disease or other forms of dementia. Respite care provides temporary care for seniors, offering family caregivers a break while ensuring the loved one receives professional support. Now, in our situation, independent living wasn't even on the table given my mother-in-law's medical condition and need for help with her ADLs. Memory care was not needed. Her mind's fine. She was still sharp as a tack, nor was respite care applicable given our situation. Number 2, costs. Buckle up for this one. Oh boy. Now, in the back of my mind, I kind of knew that senior care was expensive, but this one was the biggest shocker for us all. Costs for these facilities vary widely by region of the country, as you can see on this chart, and escalate as the level of care needed increases. For independent living, the monthly costs are the lowest of all the facility types. Seniors living in these communities don't really need any day-to-day assistance, at least initially. Since this one wasn't an option for my mother-in-law, I have limited information, but I do know that independent living communities' monthly costs can run the gamut. But in Oklahoma, the average range is about $2,000 to $3,000 per month. And many of these types of facilities offer what's called continuum of care service, meaning they offer independent living, assisted living, and skilled nursing all under one roof. They're a one-stop shop. And many have what's called a buy-in initial payment option instead of a large recurring monthly rental fee. With the buy-in option, you can pay a one-time large upfront payment to the facility. Now, here in Oklahoma, for some of the ones we heard about, the buy-in fee started at $100,000 to $150,000 and went up for there. Yikes. Depending on the facility. Paying this large upfront fee may result, however, in the resident receiving a sizable discount on monthly fees or possible waiver altogether for future care needs as the senior's health deteriorates and they move within the same facility, from the community's independent living facility to assisted living to eventually, possibly, skilled nursing care facilities. Now, this whole buy-in option is very complicated, to say the least. That's about the extent of what I know, which isn't much, but your senior care advisor should be able to fill you in on the details. When it comes to costs for assisted living, which is where our loved one ended up, in our experience, assisted living apartment rental amounts here in Oklahoma City for a studio apartment run about $4,000 to $5,000 a month, a one-bedroom $5,000 to $6,000 per month, and a two-bedroom about $7,000 per month and up. But you're not out of the woods cost-wise yet, as assisted living in these facilities have additional costs. They also charge a fee for additional care required, depending on the ADLs, there's that term again, that your loved one needs help with. And by the way, that care component cost number alone can run as high as $1,500 a month, tacked onto the base rent amount. Now, given the high level of care my mother-in-law required, the total monthly fee, including the additional care cost component, was over $7,000 a month for a very small one-bedroom apartment. Now, you ready for the really big numbers? Are you sitting down? If long-term skilled nursing care is required, i.e. a nursing home, the cost really shoots up. Now, one upscale facility we looked at here in Oklahoma City charged over $13,000 a month for a semi-private room in their skilled nursing wing. A private room in the same wing was over $16,000 per month. An insider told me that prices for a semi-private skilled nursing room in Oklahoma typically range from $7,000 a month up to that $13,000 figure we were quoted. Private rooms in Oklahoma for skilled nursing range on average from $12,000 to $16,000 per month and up. Now those are Oklahoma prices. Yours may be quite different. However, using these examples, you can see that your loved one's savings can get drained very quickly, especially if long-term skilled nursing care is required. Hence the need to often sell the loved one's primary residence to raise funds to pay for their care. Oh, and I almost forgot that regardless of the type of facility, whether it's independent living, assisted living, or long-term skilled nursing, most also have a one-time upfront additional community or application fee they charge them anywhere from $1,500 to $2,500. Availability wait list. I learned that in the U.S., wait lists to get into these facilities are commonplace as a result of too many applicants and not enough facilities. And the situation in Oklahoma City was no different. Now that was initially discouraging, but we soon found out that these kinds of waiting lists are very fluid for a couple of reasons. One, well, not to be insensitive, but the sad truth is that existing residents at these kinds of facilities, due to their advanced age and or infirmities, they do frequently pass away unexpectedly, immediately creating openings when none existed even in the day before. And or two, it often turns out that people who were previously on the waiting list ahead of you simply found availability at a different facility while they were waiting, and as a result their names were scratched off the list. The bottom line, you can sometimes move up the waiting list much quicker than you thought possible, so be patient, keep checking back, and don't get discouraged. Medicare, Medicare supplemental insurance, and Medicaid. Okay, lots of confusion on these, and rightly so, since these are huge government programs. Suffice it to say that these are very complicated subjects. I'll keep it brief and a full caveat here, and this time this is the understatement of the century. I am by no means an expert on this. But here goes my layman's explanation. Medicare is federal health insurance for people 65 and older, and some people under 65 with disabilities. It pays for a portion of an eligible person's medical and drug costs. However, in most cases, it does not cover the vast majority of seniors' long-term care living expenses, like the big dollar amounts I just went over. Medicare supplemental insurance offered by third-party private insurers covers the out-of-pocket medical and drug costs that Medicare doesn't cover. There's a gap between what Medicare pays and what you'll have to pay for out-of-pocket. And for that reason, it's sometimes called Medigap insurance. And Medicaid is a completely different animal. It's a joint federal and state program that covers medical costs for people with limited income and resources. Emphasis on the word limited, as in almost none. For those who qualify, Medicaid does cover nursing home type living expenses as well as other personal care services. I was surprised to learn that in 2023, a whopping 63% of nursing home residents in the U.S. relied on Medicaid to pay their bills. Wow. What it all boils down to is the sad fact that in the U.S., you must either pay for senior care out of your own pocket, called self-pay. Remember all those high costs I just mentioned? Or on the other end of the spectrum, people without the financial resources to pay must rely on the U.S. government to provide for their senior care via Medicaid. Unfortunately, in America today, there is no in-between solution. So should you use local or national resources to find a suitable facility? So you've probably seen the ads on TV or online for referral websites like A Place for Mom, Caring.com, or SeniorAdvisor.com. Now these three tend to dominate the market. The truth is they exist primarily as online directories linked to thousands of partner senior living communities across the U.S. As an example, Place for Mom has links to more than 20,000 of these. However, be careful. Use these sites at your own peril. In doing my research for this video, I discovered that a recent 2024 investigation by the Washington Post found, quote unquote, that roughly 37% of senior living facilities across 28 states recognized by the A Place for Mom referral service in 2023 and 2024 as award-winning communities were actually, get this, cited for serious violations affecting resident care. Uh-oh. It's not good when you're talking about more than a third of the facilities you're touting as top tier have serious problems. And what kind of violations, you may ask, were these? Well, numerous ones like falls, bed sores, medication errors, call response issues, failure to bathe or groom residents, understaffing, substandard training, along with violence and sexual abuse. Ugh. The resulting publicity from this report resulted in the U.S. Senate getting into the act, and now A Place for Mom is now under Senate investigation. for steering people towards facilities with documented safety and regulatory violations while collecting lucrative commissions from these same facilities. Now, news like this is why, in my humble opinion, you need a local, boots-on-the-ground, third-party expert that can hold your hand and knows the ins and outs of the local community's facilities, the good, the bad, and the sometimes really ugly. Now, let's face it, quality of care can change over time, regulatory compliance can lag, ownership changes can occur, facilities can become understaffed, availability is constantly changing, as I mentioned, and prices can rise dramatically, among other variables. Only someone local to the community who interacts with these places day in and day out would have real up-to-date, intimate knowledge of what's happening in your local market, i.e. they have the real dirt on what's going on in your market, which is the kind of insider information you need to know to make a smart, informed decision. Relying on an online resource for this process, while that might work for some, was not the path we chose to take, and frankly, I don't recommend it for you either. If you do choose to use only these kinds of websites, please by all means be careful and do your own due diligence. I'll just leave it at that. So if you're watching this outside the state of Oklahoma, I promised you at the outset I'd show you how to find your own local senior care advisor to assist you in your search. And in this case, once again, like so often, when you're searching the internet, looking for answers, Google is your friend. It's really very simple. Just type in the generic phrase, senior care placement and referral agencies in X, fill in your town's name in the search bar. You'll undoubtedly see a list of these kinds of local firms pop up, but make sure it's a local firm and not some national referral website like the ones I just mentioned. Most larger towns have several local firms like this. They would love to help you, and remember, again, their fees are typically free to the client's family. Again, your mileage may vary. And the fees are typically paid by the facility. Check with them in advance to make sure that's the case. If you've made it this far, congratulations. Thanks for sticking around. I know it's a lot of information. I hope it was helpful in some way, and if so, I'd be honored if you'd hit the like and subscribe buttons below and share this video with others you know who may have found themselves in this same predicament. So I'll close with this analogy relating to this whole senior care search experience we just went through. Now, when I was a young engineer, an older coworker once pulled me aside and shared with me some invaluable advice I remembered the rest of my working life. He explained to me that in the working world, you don't always need to be the expert on every subject, but you do need to know how to identify and contact the people who are experts when the need arises. And that's why I made this video. I'm willing to bet that you're probably, like my wife and I, and you're not an expert in the senior care area, but hopefully now, after watching this video, you can locate someone who is, that can help you navigate these tricky waters. And best of all, they're not likely to charge you a cent. So good luck to everyone in your search. Finally, don't hesitate to reach out and let me know if I can help in any way. I'd love to hear from you. As I mentioned, my contact information is shown down below. So thanks everyone for watching. We'll see you on the next one. Adios.